Hello dear friends, welcome back. We are discussing about the muscles of the upper limb. As you know, we have started discussion or a series of lectures on the anatomy of the human muscular system. So in my previous first lectures, you know all these, we have divided the upper limb, and then we started discussion about the muscles of pectoral region. So we discussed about the first muscle, pectoralis major, then pectoralis minor, then serratus anterior, and then we discussed about subclavius muscle. So these four muscles are in the pectoral region. Now there are muscles of back. So we know that our upper limb is divided into 6 regions: the pectoral region, the back region, shoulder region, arm region, forearm region, and hand. Now we have discussed the muscles of the pectoral region. Now we will discuss about the muscles of the back. So while discussing about the muscles of the back, right, back region to back region means the region posterior to the pectoral region. So the first muscle is the trapezius muscle, right? This one in the red, this red big muscle you can see, this is called the trapezius muscle. Now the trapezius muscle is the primary mover of the scapula, right? This muscle is responsible for all movements of the scapula. Its shape is triangular, right? You can see one angle is here, one angle is here, and one angle is here. So it's a little bit triangular muscle. Unilaterally means this one side, you know, on both sides we have trapezius muscle. So unilaterally, if you talk, it's triangular in shape and appears as trapezoid shaped muscle with the left and right trapezius are viewed on the back. So it appears as trapezoid body. That's why they call it trapezius muscle. What is the location? It is located in the back region to the pectoral region. So trapezius muscle is the first muscle of the back region. It is located posterior to pectoral region. What is the origin of this muscle? So this muscle takes its origin from 3 different parts, right? As this muscle has 3 different types of fibers. So you can see the descending fibers or the descending parts or the superior fibers. These fibers which are coming down, if you can follow the cursor of the mouse, right, these fibers are coming down, these are the inferior, right? So the descending part or superior fibers, they take their origin from the medial third of the superior knuckle line external to the occipital protuberance, right? So this part is called the origin part of the superior fibers. There are middle fibers, or they are called the transverse fibers. These fibers are coming down, that's why we call them descending fibers. These fibers are located transversely, that's why we call them transverse fibers, right? So the transverse fibers or middle part of this muscle, they take origin from the knuckle ligament attached to the spinous process of C1 to C6 vertebrae. So the middle part takes its origin from C1 to C6 vertebrae, and the spinous process and the supraspinous ligament of vertebra C7 and to T3. So it means that the middle part takes its origin from many points from C7 to T3 vertebra. Now the ascending part or inferior fibers, they take their origin from the spinous process and supraspinous ligament of T4 to T12. You can see here, this is also showing the origin of this muscle. So these are inferior fibers, superior fibers coming down, they are transverse fibers, and these are the inferior fibers. Okay, these were the origin of this muscle. Now what about the insertion of this muscle? The descending part or superior fibers insert into the lateral third of the clavicle. Lateral third of the clavicle bone, right? Then the transverse fiber, medial acromial margin, superior crest of the spine of the scapula. So these are the transverse fibers and they go to the superior crest of the spine of the scapula and the medial acromial margin. And what about the ascending part or inferior fibers? They go to the lateral apex of the medial end of the scapular spine, right? So these were the insertions. Now what about the actions of this muscle? Which type of actions does this muscle perform? Look carefully. The descending fibers, the descending upper fibers act with the levator scapulae muscle to produce elevation of the scapula. So the first action, elevation of the scapula. Lateral flexion, contralateral rotation of the scapula. When both left and right muscles contract, causes the extension of the head and neck. So your neck and head will go back. So look carefully. When these muscles contract, right, these fibers contract, they will pull your head towards the back. So your head will tilt backward, right? These were the actions. Now what are the actions of ascending fibers? The ascending or lower fibers are responsible for depression of the medial part of the scapula, right, and thus lowering the shoulder. So when they contract, your shoulders go down. The descending fibers also produce rotation of the scapula, right? And what about the transverse fibers? Retraction of the scapula and upward rotation of the scapula. These are the actions of this muscle. What is the blood supply of the trapezius muscle? The blood supply, it gets its oxygenated blood from the occipital artery to the superior part of this muscle, from superficial or transverse cervical artery to the transverse part, and from dorsal scapular artery to the ascending part. So we say that the lower part of this muscle gets its blood supply from dorsal scapular artery. The middle or transverse part of it gets superficial or transverse cervical artery, and the superior part of this muscle gets its blood supply from the occipital artery, right? And what about innervation? Its motor innervation comes from accessory nerve, which is cranial nerve number 11, and motor or sensory ventral rami of the spinal nerves C3, C4 via cervical plexus. So it gets its motor or sensory innervation from cervical plexus, right? So this was about the trapezius muscle, the first muscle in the back region. Now in the next lecture we will discuss about the next muscle, that is latissimus dorsi muscle. See you guys in that lecture.